Hi class, so this week we're covering chapter 14, Biological Aspects of Later Adulthood. So what is later adulthood? Later adulthood is the last major segment of the lifespan. The age 65 has usually been cited as the dividing line between those who are middle age and those who are old age. However, there's nothing magical about 65. So wrinkles do not suddenly appear on your 65th birthday, nor does hair suddenly turn gray or fall out. Gerontologists are doctors who specializes in medical care for older people, and they have attempted to deal with these age-related differences among older people by dividing later adulthood into two separate groups: young old, which includes ages 65 to 74, and old, which includes ages 75 and above. Our society tends to define old age mainly in terms of chronological ages. In primitive societies, old age was generally determined by physical and mental condition rather than chronological age. Such a definition is more accurate than ours. Everyone is not the same mental and physical condition at age 65. So people may be at different stages, may feel differently at age 65. Aging is an individual process and occurs at different rates for different people. It is a mistake to view later adulthood as a time of inevitable physical and mental decline. Stereotyping later adulthood is an awful stage, and sadly, it is a factor in older people being treated as second-class citizens by people who are younger. On the whole, people today are living a whole lot longer and faring better than time in history. In Japan, for example, age is a mark of status. In the United States, older adults as a group are healthier, more numerous, and younger at heart than ever before. Many people who were 70 years old think and act and feel like 50-year-olds felt decades ago. Learning objective 2 is to describe the physiological and mental changes that occur in later adulthood. Senescence is the process of aging. It is a normal process of bodily change and accompanies aging. It affects different people in various parts of the body at different rates. Some parts of the body resist aging more than others as well. When it comes to physical appearance, it includes increased wrinkling, speed of motion, increasing unsteadiness of the hands and legs, increased difficulty in moving, the thinning of hair. And wrinkling of the skin is caused by partial loss of the elastic tissues in the fatty layer of the skin. Senses generally deteriorates later on in life as well. So as people grow older, there's different changes that may occur. When it comes to senses, the sense of touch declines with age due to the drying, wrinkling, and toughening of the skin. The skin also has increased sensitivity to changes in temperature. Since the automatic regulation of bodily function responds at a slower rate, older people often feel the cold more than younger people. My mom, for example, when she was younger, she would always want the room really cold. I was always freezing because she was always hot, and the temperature was always, she would always turn up the temperature to be very cold. Now that she's older, she's always complaining that she's cold. And so now her room temperature is completely different than what it used to be when she was younger. The sense of hearing gradually deteriorates as well. The ability to hear very high tones is generally affected first. And as time goes on, the level of auditory becomes progressively lower. Many older people find it very difficult to follow a conversation when there's competing noises as from like the radio or TV or people talking. An impairment in hearing is 5 times more likely in those ages 65 to 79 than it is in people who are age 45 to 64. Men are more apt to experiencing hearing impairments than are women. And people who have a hearing impairment are apt to feel more lonely and isolated as they cannot readily join in a conversation. Vision also declines. Most people over age 60 need glasses or contact lenses to see well. Older people are likely to have a 20/70 vision or less. They cannot see well in the dark, and It's a problem that keeps a lot of them from driving, especially at night. Half of the legally blind people in the US are over 65. Cataracts is a serious concern among the older population. Frequent cause of blindness among the older people is glaucoma, which occurs when there's fluid pressure in the eye, and then that eye pressure, those fluids build up. If this is left untreated, it can affect the eye internally, and if it is detected through routine vaccines and checkup, it can be treated and controlled with like eye drops or medication or even surgery. So the senses of taste and smell have reduced functions capability during advancing years. Much of this reduced sensitivity appears to be related to illnesses and poor health rather than deterioration due to age. So taste is often based on what people can smell, and more than 4 out of 5 people over 80 years of age have major impairments in smell, and more than half have practically no smell at all. So because food loses its taste, for those who have no serious impairments in smell and taste, those affected eat less and are often undernourished. So the deterioration of certain senses can also lead to other medical. So as people grow older, they have problems with their teeth as well. Their gums may gradually recede and their teeth may become yellowish. Many people eventually may lose their teeth, and this problem is way more severe for people of low income levels who may often have financial and transportation barriers to getting dental care. So as people grow old, their gums gradually recede and their teeth may become yellowish in color. Many people eventually lose their teeth, and this is more severe for people with lower incomes. Having their teeth replaced with dentures can take a while. It can also be traumatic. On the other hand, dentures can also improve their appearance and may also help with self-concept. Many of the facial evidences of later adulthood can be prevented by proper dental care throughout their life or by using dentures. Dental health is related to a combination of innate tooth structure and a lifetime eating and dental health habits. So it's important to take care of your teeth throughout the years so that you would have less problems as you grow older. In later adulthood, the voice may also become less powerful and more restricted in range. If there are any pathological changes in the brain, slurring can also occur. So the skin for many people may become splotchy or paler in color. Or older people can do most of the same things that younger people can do, but they may do them at a slower rate. So it takes older people longer to assess their environment. It takes them longer to make decisions and to even make an assessment or implement the right action. So basically, for people who are older, learning new material can also be slowed. So have you ever been irritated when an older person was driving a car slowly in front of you? Can you imagine being on the freeway with a speed limit of 60 or 70 miles an hour and have someone driving 40 miles an hour? It's happened before, I'm pretty sure. But we need to remember that older people are probably functioning at the pace that is safe for them. So older drivers can compensate for any losses of ability by choosing easier routes. Maybe they should drive routes where, they can drive slow. So maybe not get on the freeway, driving shorter distances, and maybe only driving in the daytime. So after age 30, there's a gradual reduction in the power and speed of muscular contractions, and capacity for sustained muscular effort decreases. So after the age of 50, the number of active muscle fibers gradually decreases, resulting in the older person's muscles being reduced in size. So the hand grip strength of a 75-year-old man is only about 55% that of a 30-year-old man. Although there is little functional change in nerves with increasing age, some of the nerve tissue is gradually replaced by fibrous cells. Reflex and reaction times of an older person also become slower. There's also changes in the digestive system as well. With increased age, there is a reduction of the amount of enzyme action, gastric juices, and saliva. which upsets digestion process. Complaints about digestive disorders are among the most common complaints of older people. As people age, their lungs decrease in size as well, resulting in a decrease of oxygen utilization. The maximum breathing capacity and maximum oxygen intake in a 75-year-old are about 40% of those of a 30-year-old. The heart and body vessels are the body parts in which aging produces the most destructive changes. The heart is affected by aging in a variety of ways. It shrinks in size and the percentage of fat in the heart increases. The heart muscles tend to become stringy and dried out. The heart of an older person pumps only 70% as much blood as that of a younger person, and the rhythm of heart becomes slower and more irregular. As people age, their reserve capacity decreases. Under ordinary circumstances, people do not use their body systems and organs to their limits. This backup capacity to respond at greater levels during times of stress has been called reserve capacity. Younger adults have reserve capacity that put forth 4 to 10 times as much effort as usual. And as people age, their reserve capacities decrease. As a result, older people cannot respond to stressful demands as rapidly as younger adults. When it comes to sexuality and sexual response, there are many similarities in the physical responses to men and women. A common misconception is older people lose their sex drive. It is true that both sexual interest and sexual activity gradually decline among older adults. However, many older people continue to engage in sexual activity. The attitudes of younger adults as to what is appropriate sexual behavior for older people commonly creates problems. So many younger people believe that it's inappropriate for an unmarried older person to become romantically involved with someone. And there are negative views, or these negative views are often strongest when an older person becomes involved with someone younger or who has the potential to become an heir if the older person dies. Learning objective 3 is to understand contemporary theories on the causes of aging process. So what causes aging? The book uses several theories to describe what causes aging. The first one is genetic theories. So these theories hypothesize that aging occurs as a result of damage or changes in genetic information involved in formation of cellular proteins. Such changes cause the cells to die, which results in aging. Non-genetic cellular theories postulates that changes takes place in cellular proteins after they have been formed, and such changes causes some cells to die, which also results in aging. Accumulation theory asserts that aging results from the accumulation of harmful substances in cells of an organism. Physiological theories explain aging as being due to either the breakdown of an organ system or an impairment in the physiological control mechanism. An example of this category of theories is the stress theory, which asserts that aging is due to the accumulated effects of stress of living. Everyone grows old, so the conclusion is obvious that nature has a built-in mechanism that promotes aging, although we still do not know what that mechanism is. Some people are now living beyond 100 years old. Today, people over 100 are a fast-growing segment of the population. Some asserts that there are no fixed limit on how long people may live, while others believe that genetics plays at least a partial role in human longevity, and therefore the idea of exponential increase in human lifespan is unrealistic. Learning objective 4 is to describe common diseases and major causes of death among older adults. So most older people have at least one chronic condition and some have multiple conditions. Some of these conditions that are frequent or more common are arthritis, hypertension, hearing impairments, heart diseases, cataracts, diabetes, visual impairments. Older people see their doctors more frequently and spend a higher proportion of their income on prescribed drugs. And once they're in the hospital, also stay longer. The medical expenses of an older person average 4 times more than those of young adults. Aging is a complex process. There seems to be many variables that accelerate and decelerate the process. The precise reason why such conditions accelerate the aging process are not known. A large number of biological insults hastens the aging process. Such insults may include accidents, broken bones, severe burns, severe psychological stress, and severe alcohol or drug abuse. There's also environmental factors that may influence the aging process. Being physically and mentally active also tends to slow down the aging process. So, inactivity speeds it up. A positive outlook tends to slow down the aging process. Insecurity, the lack of someone to talk to, or um, negative thinking and being in a strange environment also tends to accelerate the aging process. Genetic inheritance also plays a role. People whose parents lived a long time have a longer life expectancy than people whose parents lived a shorter period of time. So, is genetic testing desirable? Genetic testing has a number of potential benefits. First, it will increase our ability to predict, control, prevent, and cure diseases, as well as to pinpoint specific drug treatments to specific individuals. Genetic testing can also help people decide whether to have children and with whom. And it can also assist people with family histories of a disease to know the worst that is likely to happen. On the other hand, there are a number of dangers associated with genetic testing. Job and health insurance discrimination can occur. It has occurred in the past. The adverse psychological impact of genetic testing results in another potential danger. A false positive result may cause needless anxiety. In addition, some genetic conditions are currently incurable, so there's little point in knowing that you have the genes for such conditions if you cannot do anything about it. There's also adverse psychological consequences to knowing you might develop a life-threatening disease at 20 or 30 years from now. So, do the potential benefits of genetic testing outweigh the potential dangers? That will vary depending on the condition. So, I guess whether it's desirable or not can only be answered based on looking at the benefits versus the disadvantages of doing the test. Some of the leading causes of death among older people in the US include heart disease, cancers, lung disease, strokes, Alzheimer's, diabetes, and pneumonia. So the average life expectancy in ancient Rome and during the Middle Ages was between 20 and 30 years. Some people lived to be 70 or 80, but infant mortality was very high. Famine, diseases, and wars also took over the lives of many. Life expectancy of Americans has gradually been increasing due to better sanitation, nutrition, and disease control. In the middle 19th century, Americans lived for about an average of 40 years. At the turn of the 20th century, it was 49 years. In 2015, the average life expectancy was 79 years. Environmental factors have demonstrated by fact that men are more likely to die from suicide, accidents, and homicides. So there are some significant sex differences found in life expectancies. In 2015, females in the US had a life expectancy at birth of 81 years, whereas men had a life expectancy of only 76 years. There appears to be both environmental and biological reasons for higher mortality rates among men. Environmental factors are demonstrated by the fact that men are more likely to die from suicide, accidents, and homicides. And men are more likely to die from lung cancer, heart disease, and asthma, all of which have been linked to environmental causes as smoking, alcohol, and alcohol abuse. Biological factors are probably also involved in leading to higher mortality rates among men. The higher mortality rate among males in the fetal stage and infancy supports the notion of an inborn difference in resistance. So, that there are many more women over age 65 than men means that women are much more apt to be widowed. So, in 2015, the sex ratio among those 65 and over was 136 women for every 100 men. Since there is a custom in our society for men to marry someone younger, husbands are even more likely to die before their wives. Women are thus much more likely than men to spend their later years alone. There are a number of factors that have been found to increase life expectancy. Parents and grandparents lived to 80 or more, being married for most adult years, not being overweight, exercising regularly, light drinking, not smoking, being basically happy and content with life, graduating from college, living in a rural environment, having regular medical checkups and regular dental care, um, and routinely using stress management techniques. There are some factors associated with shorter life expectancy, and those are when parents or grandparents died of an illness fairly early in their lives, such as like heart attack or a stroke before age 50. Parents or grandparents had diabetes, thyroid disorders, breast cancer, cancer of the digestive system, asthma, or chronic bronchitis. Being unmarried for most adult years, being overweight, not exercising regularly, drinking heavily, smoking, being aggressive, intense, and competitive, often being unhappy or worried or feeling guilty, not completing high school, living in an urban environment that has moderate to high levels of smog, experiencing frequent illness, experiencing high levels of stress, and engaging in activities that are high risk. Learning objective 5 is to understand the importance of placing the highest priority on self-care. Older people are apt to experience little physical or mental deterioration if they have a nutritious diet or are successful in managing stress and stay mentally and physically active. Traditionally, the health profession in this country has focused on treatment of disease rather than prevention. The Chinese approach to medicine has focused on helping patients maintain good health. The holistic concept of treating the whole person is gaining ground in America. There is now greater emphasis on prevention, wellness, and treating a patient psychologically and socially as well as physically. For people who have had poor health maintenance habits, it is nearly never too late to change. Many studies have shown that older people benefit from a variety of exercise programs that include walking, swimming, and weightlifting. There's also evidence that as people grow old, continued exercise reduces the degree of physical and mental slowness that occurs in many older people. When it comes to mental activity, our society needs to put more emphasis on ensuring that people are exposed to intellectual stimulation. Some nursing homes and retirement communities are now having daily programs that provide such stimulation. So, just as physical exercise maintains the level of psychological functioning, mental exercise maintains good cognitive functioning. As mentioned, there are some age-related declines in cognitive functioning, but if a person is mentally active, the decline begins to appear at a later age and are less severe. So our society needs to put more emphasis on ensuring that other people are exposed to intellectual stimulation. And now some nursing homes and retirement communities are including daily programs that provide such stimulations. Many older people have one or more sleep disturbances, such as insomnia, difficulty in falling asleep, restless sleep, falling asleep when company is present, frequently waking up in the middle of the night, and maybe feeling exhausted or tired after not having a full night's sleep. It appears that older people in fairly good health require no more sleep than do those in middle adulthood. Sleep disturbances that older people experience tend to be a result of anxiety, depression, worry, or illness. Restless sleep is common for those who are inactive, those who catnap too much, and those who have physical discomforts. The majority of older people have inadequate diets. So, because of the relationship between diet and cardiac problems, physicians recommend that older people eat a low-fat, high-protein diet. Numerous programs have been developed to improve nutritional health for older people. Meals on Wheels is a service that delivers hot and cold meals directly to housebound recipients who are unable to prepare their own meals, but who can feed themselves. Learning how to manage stress is important for physical and emotional health of all age groups. So, stress is a contributing factor in most physical illnesses. Learning how to relax is important in treating and facilitating recovery from both emotional and physical disorders. The increased recognition of stress management in treating physical and emotional disorders is gradually altering the traditional physician-patient relationship. Effective stress management is also a major factor in enabling people to live fulfilling, healthy, satisfying, and productive lives. Stress can be defined as the physiological and emotional reactions to stressors. There are infinite variety of possible stressors. So, loss of a job, loud noises, toxic substances, retirement, arguments, death of a spouse, moving into a nursing home, hot or cold weather, serious illnesses, a lack of purpose in life, and so on. So, every second we are alive, our bodies are responding to stressors that call for adaptation or adjustment. Of the five major categories of approaches to stress management, only three are constructive in terms of empowering a person and helping him or her gain greater control over life. The three constructive approaches are changing the distressing event, changing one's thinking about the distressing event, and taking one's mind off the distressing event, usually by thinking about something else. So there are also two destructive ways that some people use to relieve stress. One involves resorting to alcohol, other drugs, or food. Perhaps the major reason for abusing alcohol and other drugs is to seek relief from stress and unwanted emotions. Drugs may provide temporary relief, but the next day a person's problem will still be there, and there is a serious danger that drug abuse may become a destructive habit. Compulsive overeating is also an unhealthy way to temporarily relieve stress. The second destructive way of escaping stress is suicide. When distressing events occur, it is desirable to confront them directly to try to improve the situation. An older person concerned about what to do with his or her time after retiring needs to work on finding meaningful and enjoyable activities to become involved in. Many distressing events can be improved by confronting them head on and making constructive action to change them. Some events cannot be changed. For example, John Garcia, age 64, had experienced such severe deterioration in his eyesight that he is no longer able to drive his truck by which he earned his living or even a car. Since one cannot change the situation, the only constructive alternative is to accept it and find meaningful activities unrelated to driving. It is counterproductive to complain or get upset about something that you cannot change. One of the structured techniques for changing one's thinking about a distressing event is to challenge and change a negative and irrational thinking through a rational self-analysis. When unpleasant events occur, we have a choice to take either a positive or a negative view. If we take a negative view, we are apt to experience more stress. Every person needs someone to share good times with and to talk with about personal difficulties. Sharing concerns with someone helps to vent emotions. The listener may be a good neighbor, a friend, a member of the clergy, or professional counselor. Talking a concern through often helps to reduce stress in two ways. It may lead to a new perspective on how to resolve the distressing event, or it may help by changing one's thinking about the distressing event to a more positive and rational attitude. There are a variety of ways to stop thinking about a distressing event. Relaxation techniques, for example, includes deep breathing relaxation, imagery relaxation, progressive muscle relaxation, meditation, and biofeedback can be some effective techniques for reducing stress and inducing the relaxation responses. Mindfulness is another way to relieve stress. It is another tool that social workers can readily use to reduce stress. Mindfulness meditations have increasingly been utilized in a variety of settings, including mental health agencies, schools, and medical settings. Mindfulness is a state of consciousness with enhanced attention to moment experience. Mindfulness involves maintaining a moment by moment awareness of our feelings, thoughts, bodily sensations, and surrounding environment. So, exercise and pleasurable goodies are another ways of reducing stress. Pleasurable goodies reduce stress. It changes our pace of living. They're enjoyable. They make us feel good. However, what is good or goody to one person may not be to another. Common goodies can be hug, listening to music, going shopping, taking a bath, going to a movie, having a glass of wine, talking to maybe your family. Social workers are one of the groups of helping professionals along with psychologists, psychiatrists, and guidance counselors. Social workers have a variety of roles in stress management. They can serve as educators in providing stress management education programs to individuals and groups. Social workers can incorporate relaxation training and biofeedback training in their counseling sessions with clients, particularly those experiencing high levels of stress. If highly stressed clients learn to relax, they're often more effective in solving their difficulties. Social workers can serve as brokers in referring highly stressed individuals to stress management programs, and they can serve as facilitators in leading therapeutic groups that emphasizes stress management. Social workers can serve as brokers in referring highly stressed individuals to stress management programs, and they can serve as group facilitators in leading therapeutic groups and emphasize stress management. Social workers can also serve as initiators and consultants in developing stress management programs in schools, businesses, and other medical settings. And this brings us to the end of chapter 14. We will pick back up next week in chapter 15.